Alright, this is my focused cardiovascular and respiratory exam. When I do a physical exam on a patient, I wouldn't be listening or visually inspecting through a shirt, but for the purpose of this demonstration, I will be. I would approach the patient. I check for respiration rate and rhythm. Make sure there was nothing wrong there. Make sure there was no obvious shortness of breath. I'd visually inspect the patient's face. There's no pallor. I'd come up, I'd look at the patient's hands. No clubbing, capillary refill is fine. I'd come up, I'd check the patient's pulse rate. I'd come and I'd do a radial, check for any radial to radial deviation, any radial to femoral deviation. I'd come up, I'd check the patient's blood pressure. I'd come up to the patient, turn to your left for me. I'd check for any jugular vein distension. I'd gently pull down on the, you can look forward now. I'd pull down the eyelids, look for any pallor there. Have the patient open their mouth. I'd look here, make sure the dentition was okay. Look for any central cyanosis. That's fine. I'm close now. While we're still up at the head, I'd listen to the carotid pulse on both sides. Check for any bruit. Palpate the carotid pulse. Okay. At this point, I'd find the apex of the patient's heart, which is in the fifth intercostal space, left side. I would have the patient turn on their left side, which brings the heart forward as can be, and in that position, I'd listen at the apex, listen for any mitral stenosis. All right, at that point, I'd listen to have the patient turn back over, sitting back up, listen to the apex, listen to the tricuspid, pulmonary and aortic valves of the heart. Listen for any extra heart sounds, any murmurs. At that point, I'd feel for any thrills or heaves. We don't feel any. Okay, we're gonna at that point we're gonna listen to the patient's lungs. Start here. Take a deep breath and out. Deep breath and out. We're going to do it 6 spots anteriorly. Deep breath and out. Deep breath and out. Deep breath and out. Deep breath and out. And deep breath and out. Alright, we're going to come back behind the patient. Same thing on the back. 6 spots. Deep breath and out. 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 And deep breath and out. Alright, I'm going to feel for any tactile fringes. I'm going to have the patient say 99, 99, 99 as I feel. I can either use the tips of my fingers, the balls, or this aspect of my hand. 99, 99 as I go down. Okay, I'm going to percuss the chest, tap on my finger. If I felt any, or if I heard a change in the sound of dullness, that would mean that there was a mass. If I heard a change in the sound or raise in the pitch, tympany, that would be a sign of a pneumothorax. Alright, now I'm going to check for sacral edema, which is a sign of congestive heart failure when I'm at the patient's back. Alright, now I'm going to check the patient's pedal pulses. I'm going to be looking for any peripheral edema, which is also a sign of congestive heart failure.